Okay, while they're finishing up their entry, I would like to introduce Paula Lee. She is a dental, yay, Paula. Such a supportive crowd. You have a lot of fans. So Paula is the dental hygienist consultant with the Office of Oral Health. She's the coordinator for the state's school-based, school-linked dental programs and the lead for the school dental program work group. And she will be pitching implementing evidence-based school dental programs. Welcome, Paula.
Hello. Just a little information about myself. My MBTI is an ESTJ. So this feeds my soul and gives me energy. So very happy to be with all of you. Another thing that I do at the Office of Oral Health, I do a mindful minute. Would you guys like to join me in a mindful moment? Okay, that sounds great. So this is what I do. So a mindful moment, it's a way to check in with yourself to see how you're doing and just take a moment to kind of check in. So I invite you, if it feels comfortable to you, to close your eyes, or if not, just have a nice soft gaze looking down. Go ahead and put both feet on the floor. Your hands relaxed and not looking on your phone or your laptop. And go ahead and take a nice long inhale. And a nice long full exhale. Let's take one more together. Nice long inhale. Nice long exhale. And with your eyes still closed, just check in to see how you're doing. Is there some muscle tightness? Can relax your shoulders away from your ears. And if you're still breathing, on your next exhale, relax your abs, relax your jaw, create some space between your teeth. And whatever is coming up in your mind, just let it pass. And then together, let's take another inhale together. And a nice long exhale. If you had your eyes closed, I invite you to open your eyes and welcome back to the room and your table mates. And I will start with our school dental program. Yay. So I like the speed dating idea, Dr. Glassman, and I hope you guys all take time to go on a date with me. So this is just a disclaimer that this is the author's conclusions and it's not part of necessarily CDPH or Department of Healthcare Services or Department of Health and Human Services. So let's start with the law a little bit. So the Children's Dental Disease Prevention Program, Health and Safety Code, when this was enacted back in 1996, they found that 95% of all children have had a dental disease. So that means dental cavities, periodontal disease, and the dental disease, in children, because we talk about the whole lifespan, right? So from, Dr. Lynn Walton Hayes talked about fluoride varnishes in pediatric offices, and we look at all the way down to our Medicare population. So if we start with early children and we look at that, then we hopefully decrease the pipeline for people who are on ER visits, that kind of thing. So with early intervention, and dental diseases result in significant life disability, dental pain, missing teeth, the lost time in school and work. And this law really is once established for children in preschool through 6th grade, a preventative dental program. And it was to be established on a state level and then operated on a local level. So then we move on to COHA, our favorite, our AB 1433. And in this law, it looked at, which all of you know, because I'm preaching to the choir, that oral health is part of and integral to overall health. And that tooth decay is the most common chronic disease in children. And in California, unfortunately, ages 6 to 8-year-olds are experience at 2 times the rate of dental disease than other states. And then also a thing that we have discovered through our third grade smile survey is that there are profound disparities in oral health outcomes, and there is an underutilization of dental services for children. And it is the number 1 reason for school absenteeism. And currently the gap is we really do need a referral management system. Some locals have a good local referral management system, but here at the state, we're going to procure one and offer it free to local oral health programs. Common causes and shared goals. This is where I get to know you. You know how you go on a date and you want to find some common ground and where we share common interests. Well, this is one that we're going to talk about our common interests. And so here at the state oral health plan, we are looking to reduce tooth decay and untreated tooth decay. And we're trying to increase our dental sealant prevalence. We have the Moving California Oral Health Forward grants that we're on the second 5-year grant, and we're in the first year of the second 5-year grant. And our main goal is to reduce racial and ethnic disparities in oral health among 3rd grade children by 50%. So there's where our health equity comes in. And for CalAIM, the CalAIM goal is that we want to increase utilization by 60%. And for eligible children, and currently we're at 46%. And then for California Department of Education, we're looking at reducing high chronic absenteeism rates in priority in the local, make that as a priority for the LCAP process, which happens every 3 years. Next, our assessment is I will pay for the first date. So we are going to go support local oral health programs, and we're giving $16 million every 5-year grant cycle to create the local oral health programs. And we want to implement school-linked and school-based dental programs in the 4,635 high-need priority schools, which means all rural schools and those schools that have 50% or more students enrolled in the free and reduced meal plan. And we want to, like I said, procure an electronic referral management system, and CalAIM, which Dr. Adriana Bashara, sorry, I messed up the name, but we have CalAIM, and we're encouraging preventive services and continuity of care. So recommendation North Star. So in our current 5-year grant cycle, it's kind of like maybe an arranged marriage, but it is our North Star for our 5-year grant cycle. And we want to do school dental programs as our North Star. And the way I look at this is that toothbrushing, we're looking at ages 3 to 9-year-olds. So we're going to start with toothbrushing and early childhood education. We're going to do COHA for 1st grade, and then screen and seal all molars for 3rd graders. And that dental referral management systems across all of them. So, and that this is currently where we're at, where, you're going to hear more about results, turn the curve on results-based accountability, but it uses data-driven decision-making to really help our health outcomes in communities as well as within CDPH. So currently we're at a percentage of school districts participating in COHA. And so you can see that we're still headed in the right directions, but we want to get to that 50% mark. And then in terms of the next COHA metrics that we're looking at is that our target for the percentage of kindergartens turning in a COHA form. So we want to get up to 35%. That seems maybe a little low, but we are going to try to get there for the next 2 years is what we're going to do. And then here's some potential measures. This is just ideas, right? So how do we measure and look at sealants, right? Like how do we look at, we already have COHA, but how do we look at sealants? So these are some ideas that we have for our cavity-free children in California. We're looking at percentage of 3rd graders with caries experience and the percentage of 3rd graders with untreated caries as a potential data points. Here's our code data on top. And then at the bottom, we're looking at school-linked school sealant programs. So those are potential ideas too of how we might want to track that and use results-based accounting to really drive our programs. And then what is our next step in our dating process? When's our next date? And this is some recommendations, is that we continue to create cross sector collaborations with education and public health. And then state school dental referral management system. We want to leverage Medicaid, the federal financial participation, pull down some of that federal funding. And we want to explore ways to obtain dental benefits and coverage, information from parents, and then encourage state educational departments to leverage the local control formula funding. So this is my last slide, and I just really want to encourage that school really is the intersection of education and health for really whole child wellness. So thank you.